this. I am not at the doctor's office because I'm here for a checkup. I'm here with my very good friend, Dr. Robert Lader, who has been so helpful for me to understand my hormones better. So, reminder, we're talking all about cycles, and I bribed him to do this. I asked him to do an Instagram account. His response was,
I don't do Instagram.
No, your response was hell no. That's what you said. You said hell no, I don't do Instagram account. So I know I'm reaching for getting my help, but I really
But
do.
this is okay.
This is good. This is good. So, how many years have you been in practice?
So I've been in practice now 39 years.
39 years, and I always ask this question because I think it's remarkable. How many babies have you delivered?
Over 12,000.
Yes, and he's not even an OB. That's amazing. I'm kidding. You're an OB. I'm messing.
I'm an OBGYN. Yes, I am.
Okay.
Board certified. Yes.
Yeah, I'm just kidding. 12,000 babies. That's a lot. It's a lot of women. It's a lot of mothers he's helped over the years. So he was the person I thought of, and I'm like, oh, I wonder if he'll say yes. So I'm really grateful.
Yeah, I'm glad to.
Thank you.
Hormones and periods are very misunderstood.
Right. And I was telling Bob earlier that I wish I would have understood more about cycles and periods when I was actually in like my baby making years, and that ship has surgically sailed. That's no longer a track that I'm on, but I know that there are people who just they have no idea. They have no idea about their cycles because you learn it in 7th grade and then you never talk about it again.
That's right.
But why is that? Why do you think that?
Well, I mean, even back when I first started in practice, I would do talks at Mutual back in the day with Lindsi Society, and it was amazing how many women had no clue what their anatomy was.
Right.
Let alone what the hormones did or didn't do.
The things you don't see.
And the only thing that we did with hormones way back was if you were menopausal and you had symptoms, estrogen, progesterone. And nothing ever really considered hormonal treatment prior to that.
So let's start with hormones, because I think that people have a large misconception about hormones. They don't understand that men and women both have estrogen, progesterone, and testosterone.
Correct.
Both. Now, can we talk about levels in both and why they're different?
Well, women, they have major conversion of their testosterone to estrogen. And that
Say that again? Hold on.
So women have a lot of testosterone,
okay,
but they convert most of it to estrogen. And estrogen gives them their female characteristics and creates their changes in their uterus for creating periods, because the body is set up in the reproductive years as far as periods to get pregnant every month.
Well, I thank the good heavens that didn't happen.
So your body's set up to do that, and then there's different things that can interfere with that, make periods irregular, make periods not come, be it thyroid, be it structural issues, be it weight loss, weight gain, be it stressors. A lot of things interfere because the message from brain to ovary can be messed up very easily
if that balance is not there.
If the balance is there. So when you have a normal scenario, healthy person, regular periods, then you know they have normal estrogen, progesterone production. And people say, well, I think my estrogen's low or my progesterone's low. Estrogen varies from 25 to 525 in a cycle. Progesterone varies from 0 to 20. And so
that just depends on where you are in your cycle, right?
And so someone will go in and say, my hormones are all messed up. I need something checked. And so they'll check an estrogen and it's 20. Well, that means absolutely nothing.
Yeah, where are you in your cycle?
My progesterone was 0. That means absolutely nothing. So if a woman is healthy and having regular periods, you know her estrogen progesterone is fine. If they have skip periods and they're young and healthy, usually they're not ovulating, not producing progesterone, but they're still making plenty of estrogen. So no woman should ever need estrogen before menopause, unless there's some premature menopausal symptom or something like that. Now, should progesterone? Yes. Thyroid changes? Yes. Testosterone? Yes. But everybody has a different view of that. But in all the years of my practice, unless you are menopausal, you should never have estrogen.
So I feel like one of the most important takeaways for me for learning all about cycles is you have to pay attention. You have to pay attention. Like, people can go, they'll say, oh, I haven't had a regular period in years. And I'm thinking, you should be, write it down and figure out, what's happening when. But I feel like they just kind of blanket it all together. There's so many moving parts to having healthy cycles or regular cycles for whatever it is for you. But if you don't know, you don't know.
Right. And so if you're thinking, well, I haven't had a period for a while, or I don't know when they're happening, then calendar it out, see what's happening, because there are different things that can interfere with the period. Low thyroid, low vitamin D, poor absorption of B12, stomach issues with absorption, too much weight, too little weight, too high of exercise activity.
Stress.
Stress is huge. COVID made a lot of changes in people's periods because of being cooped up, stress. Mm-hmm. And even though they didn't show much, the message from brain to ovary was showing that stress. Mm-hmm. And then they have different periods and lack of periods and things like that.
So if someone is having I'm going to be honest, I have really short periods, and I always have. And we work together with my hormone care, but mine is always 19 days or less. If I can get to 19 days, like that's normal for me. Like I think it's not that it's like, oh, my days, my cycles are shorter, but mine are consistently, they're always shorter.
Right.
So
I
feel okay
end to
about
start,
that.
or is that start to start?
So that's start to start.
Yeah.
Yeah.
And so you're right at the maximum closeness we want you to be.
Mm-hmm.
And some people will go 3 months between periods, and that's fine if they're not trying to get pregnant. And in the younger years, to skip periods for 2 or 3 months is not a problem. Now, if someone's in their 50s or close to menopause, 11 periods, but they go 3 or 4 months without a period, that can be dangerous if they're not truly menopausal. Mm. Because they're still producing estrogen, they're not ovulating. If they don't slough out that lining every 3 or 4 months, they're at risk for uterine cancer. And so it's a very different picture for a young woman, young girl just starting a period. She may go a year without another period. Right. Women in their 20s to 50s, they should mostly have a period once a month. As you get into the late 30s, 40s, some women will start spacing, skipping, getting lighter because their ovaries don't work as well. By the same token, they may get closer, heavier, and longer. So in the late 30s to 50, we accept change to a point. We don't want you closer than that 20 days. You're 19, we'll give you that extra day.
I talked to my doctor about that later on.
We don't want you to go 3 months, more than 3 months without a period. Because if you do, then we want to know, well, are you really menopausal? Or are your ovaries not working well? Or you're not ovulating? Because if you're producing estrogen at an older age, which your ovaries will up to about age 52, and you don't slough that lining off every so often, it puts you at risk for uterine cancer. So we watch this different in age groups.
I think too that health professionals they're experts, but I think you have to be your own expert. And if you don't get the answer, you don't feel good about it. That's actually how I found Dr. Later. Is I didn't know him before, but I had seen another OB who I loved. She's amazing and fantastic, and she delivered my babies in higher situations. But I was in my 30s, and I was like, oh, something does not feel right. And when I saw her, it wasn't like I was, my babies were much larger. Like Gigi was probably 4 or 5, but I knew something was wrong. And she just said, you're 30-something, you're busy. And I was like, no, like I don't want to do the things I love. I feel so tired. I'm exhausted all the time. I was having some change in my hair and in my skin and weight as well. And so I went and saw her, and she was like, yeah, let's check your thyroid, which I feel like most people I feel like that was like a 1990s, check the thyroid first, right? And they did. And then she said, nope, you're normal. And I was like, I knew something was not right, and told a friend. And then she said, have you ever had a hormone panel done? And I said, no. She goes, have you checked your testosterone? No. That's how I found Dr. Later. And we work together, but I'm in charge of my symptoms. I'm in charge of communicating to him if something is too much or too little. It's not his job to say, like, how do you feel today, Lindsay? He's delivering 12,000 babies. That's not his gig. That's my job.
It's my job.
It's your job. You're not going to follow me around and ask how I'm doing all the time. Maybe you would. I think you're pretty busy. But point being, be an advocate. If you don't feel like something is right with a practitioner you're working with, or they're not hearing your concerns, then find somebody who will. I actually went back and talked to my OB and told her what I was doing. And I thought this is wild. She's younger than you are, but she had no idea what I was talking about when I said I was taking a testosterone pellet. And she's like, I've never heard this. And I was sure to tell her, because I said, there are people like me where I was going to either get an antidepressant, or I didn't know what I was going to do because I was so miserable. And this was an answer for me. Now, keep in mind, I also do my best to eat well and to exercise and have healthy relationships and be in nature. It's not like this Band-Aid to fix it, but it is such a part of my life now that you have helped me manage that. It is like me being happy and having a fulfilling life, and me being miserable.
Well, when you look through the years, these symptoms have been around forever. I'm tired. I know energy. My
Don't
sex
even think
drive
about
is going
sex.
away.
Yeah, don't even think of that. I'm like a camel once a year.
Don't even want it. Nothing sounds fun to do.
Exhaustion.
I'm exhausted all the
Mental
time.
Mental fog.
Foggy brain. Poor attitude. Nothing makes me happy. And so they say, well, there's a lot of things that cross over. Thyroid can cross over. Depression can cross over. Mm-hmm. Then there was, back in the day, the chronic yeast syndrome and chronic fatigue and
like adrenal fatigue, that kind of thing.
All these things. And they all kind of crisscross in those things. Poor sleep, poor moods, poor sex drive, poor sex function, weight gain, no energy. Mm-hmm. And so they'd test these things, or they'd treat for that, and you still felt the same. Mm-hmm. So then you were depressed. Mm-hmm. And so everybody got antidepressants. Mm-hmm. And Prozac came out. I think Utah is one of the biggest states for prescribing Prozac. Mm-hmm. And that helped some, mm-hmm. but it really wasn't the answer. And so people became more aware of their bodies, became really active in exercise, better eating, and just look at all the trends we've had in exercise and health.
Yeah.
And then you start seeing more focus on men as far as testosterone, and you see these men's health advertisements.
Oh, you can't watch any sporting event without a commercial being on for testosterone.
Yeah.
You cannot. I dare you. Let me know if you find one.
And now you go through most of these wellness clinics, mm-hmm. and you'll see even on their doors testosterone testing, and it's not limited to just men. Mm-hmm. We're seeing a huge advantage in women.
Talk to that as far as like application potencies and where you should really go if you are concerned that maybe you are off hormonally. I don't think you want to walk into a GNC and guess. I think you want to. I mean, what are the steps that you would recommend taking?
The trouble is with GNC. I mean, those
I shouldn't say that. Sorry, but whatever. You know what I mean? Okay.
But any health food store, what they give as far as adrenal boosters, testosterone enhancers, growth hormone enhancement, those are so weak.
Yeah.
That they can give them out.
Right.
Over the counter.
Right, that makes sense.
So people will try them. I think you get a placebo effect from a lot of it when you first started. A month later, so there sits the rest of the bottle. You don't never use it. Mm-hmm. So when we started looking at things, yeah, we check testosterone, but we also check thyroid because that can be an issue. Mm-hmm. We check vitamin D because if your D is low, your thyroid is not going to work. B12, poor absorption, more anemia associated with it. And then testosterone. And what we're seeing now, testosterone, since I've been in practice, is the first thing I've seen that's made an actual difference in how people really feel. It gives better energy, better moods, better sleep, better focus, decreased foggy brain, less anxiety, better moods, better sex drive, better sex function, weight maintenance. Amazing how many couples will come in, their husband said, go get your pellets, you're so damn ornery, I can't stand you.
It's so true.
And vice versa.
It's true. I mean, I would say it's made up the difference for everybody, but for me, I went from like Cruella de Vil to Cinderella, like in a matter of 5 to 10 days. And I am so in tune with my body now. I'll tell Bob, I know the day, the frequency that I go through mine is 12 weeks, and I know exactly. I recognize the feeling going, okay, I know this feeling. So I do not wait. Nothing else matters. No other appointments matter for anyone in my family unless I have.
And so she texts me and says, I got to have it now.
I know, and he always fits me in. He's so nice. That's what's great about having a backdoor doctor. But it helped me to become more in tune to how I was feeling.
Yeah, because you're aware of how when you feel great.
Right.
And how you want to stay there.
What are the types of testosterone treatments you can have? Since we're talking all about testosterone, I get a pellet, and people are like, "Does that hurt?" We just walk them through what a pellet is.
Well, back in I've used testosterone for the last 30 years, but only in cream form. We've used it for vaginal dryness, painful intercourse, and that would enhance sex drive.
I didn't know that was a testosterone juice for it.
Yeah.
Really?
And so we used a lot of it back then. And we give testosterone shots once a month or every 2 months to women to enhance their sex drive. Mm-hmm. So we did use it, but not to the degree that we use it now. and men would get it, but now they're doing a shot weekly. Women to get shots, it's just too aggressive as far as acne and facial hair and everything else. So we still use the people who have just symptoms of vaginal dryness, which starts happening in menopause. So absence of estrogen makes the vaginal tissue more thin, more dry, painful intercourse, and takes the desire away. And if it's going to hurt, who wants to have sex?
Right.
Nobody.
Right.
So the testosterone cream vaginally reverses that. It strengthens the tissue, makes it more elastic, helps the tissue.
I did not know that.
And a lot of people prescribe it now, but they have it rub it on their thigh or their inner arm.
Right.
No, rub it vaginally where it's going to do its job. And there are other things for that changes the vaginal atrophy. There's doing the laser treatments, the Mona Lisa type treatments. Those are laser treatments. You have to do 700 pop, and then you have to do it every year. And I've seen some success with that too. But I think the testosterone, for me, does a better job, easier for the patient to do, and it's long-term, and it can be sustained long-term. And so then people say, well, can I try the cream first to see if I like it? Sure, but it's not going to do the things of energy and moods and everything else. Troches, which are lozenges that dissolve on your tongue, they can be done. We put testosterone in. You can even, if there's someone still using estrogen, you can put estrogen in it, you put progesterone in it, you put DHEA in it, and you dissolve it on your tongue every day. And so if someone's menopausal, having severe hot flashes, night sweats, insomnia, doesn't want to do a pellet, then a lot of times if they're less than 57, we'll put a little estrogen.
Well, that makes sense too. If you are someone who's in a serious deficit of testosterone, clearly like a lozenge or a cream is just not going to do it. But if you're someone who's like, oh, I maybe could use some, maybe it's a good option.
Yeah. The pellet, fortunately, has been good to take away menopausal symptoms too. Hot flashes, night sweats, and insomnia. And where that really came into light were breast cancer patients or patients who had blood clots cannot take estrogen or progesterone. And so they were absolutely miserable. And so when we started using testosterone therapy and pellet therapy in those ladies, it was life-changing.